Welcome back. A low-dose version of the Pfizer vaccine for children ages 5 to 11 has been approved by the CDC. Some children in Oklahoma have already received the shot. Joining us today to talk about this childhood vaccine for younger children, what he would recommend, is Dr. Jeff Johnson, emergency room physician at Hilcrest. Good morning, Dr. Johnson.
Good morning.
Let's start off with the vaccine itself. What makes this a vaccine that's suitable for children, a pediatric vaccine?
Well, it's been tested in a lot of people, really going over the last year and a half, and then they've slowly been testing it in younger children, and the most recently ages 5 and up. So it's a lower dose. It's a third of the dose of the adult, and in the studies so far, it's been shown to be very safe, no serious side effects. So it looks promising for children.
We know that some Oklahoma children have already received it. 375,000 Oklahoma children, according to the State Department of Health, are eligible for it. It's the Pfizer only. So tell us about what are some concerns that maybe you're talking about with parents about getting this?
I think some people, the biggest concern you hear over and over is that they don't think it's been tested enough. And for which I say, this is really the most highly scrutinized vaccine in history. It's really been shown to be safe. The studies, especially in children, have shown to be very safe. The smaller dose looks to be good for them. So just reassure them that all of the proper testing and reviews have been done. As we saw with the Johnson & Johnson earlier in the year, if there was concerns, they would stop it, which they did not do with this. So I really should feel safe that this is a good vaccine for their kids.
In terms of children specifically, why is it important to vaccinate children against COVID-19, specifically that younger age group?
Now, there's two real reasons we vaccinate kids. One is for childhood diseases. That's the one that we would make the most sense to us. But we also vaccinate kids for public health reasons. Parents might say, well, kids really don't get sick and die from COVID, but the same can be said of the flu. We vaccinate children, all the way down to less than a year for flu, not necessarily because children die of the flu, but because they give it to vulnerable and elderly people. So the real reason that we need to vaccinate against COVID again for all of us is that so we can get through this. And vaccinating children would be one big step in really reducing transmission.
I wanted to ask you about the kind of evolution of COVID here as we've seen the variants pop up. This was one of the more recent variants, the Delta variant, of course. It seemed like, Dr. Johnson, it changed a little bit about what we thought of childhood transmission with COVID. Because that original virus, it seemed like it didn't affect them as much. I mean, it kind of helped me out here with what this newest variant means for childhood transmission.
Yeah, the Delta variant was just so much more contagious than the original COVID-19 that came to the United States. And so transmission was up really amongst all people. Plus it kind of hit as we were going back to school. Things were more open, less masking. And so we did see more children getting COVID during the Delta variant. And along with that, we saw more children getting sick and even dying from COVID from the Delta variant.
And also, I wanted to talk about, we started off with, of course, adults only, then 12 and up, and now we have a vaccine for ages 5 to 11. Do you see us going younger with that in terms of the country, in terms of the CDC approving potentially a vaccine for someone in the flu shot age range, which I think flu shot is 6 months and up, right?
Yeah, I wouldn't be surprised. I think that they'll continue to look at it. I think they'll continue to do studies on children for the safety. But, the reality, if you just look at the way the vaccine is made, there's really no reason that it shouldn't be safe in that age. But of course, we just like to be very, very careful. You have to see it in action some before you would approve it for, general population use. But I expect to see it get approved even in younger.
And for the Pfizer specifically, we're talking about that mRNA, which is not the live virus, correct?
Correct. Yes. It's just a piece of protein that goes into your cell. It's not even made from the virus. It has no virus in it whatsoever.
Well, Dr. Johnson with Hilcrest, we thank you so much for your time. Dr. Jeff Johnson, we appreciate it.
Thank you.